I'm Charles Freeman. I'm the Freeman Chair in China Studies here at CSIS, and my job is pretty simple. I get to hand the mic over to Susan Denser and have her moderate what I think is going to be a pretty spirited debate among two friends and colleagues who know a lot about the issue that we're going to talk about today. But Susan Denser is familiar to many of us from her years with PBS NewsHour, but is currently the editor-in-chief of Health Affairs, which I would venture to say is probably the leading peer-reviewed policy journal looking at the intersection of health policy and healthcare issues generally. So fundamentally qualified to guide the point-counterpoint that we're seeing today. Before I close and turn it over to Susan, I'd be remiss if I didn't say at least something about the Sendai quake and the fact that considering we're talking about health issues, there's a real humanitarian crisis that's unfolding in Sendai, and my heart goes out to them, and I hope all of yours does too. So with that, I'll turn it over to Susan. Thanks.
Thank you very much, Charles, and good morning to everybody. It's great to be here again at our latest installment of these debates on fault lines in global health. I also want to say welcome to those of you who are joining us on the live webcast as well. For any of you who missed the first three debates and desperately want to see them, they are still available on the web at smartglobalhealth.org/faultlines. Those events have really typified what we're trying to accomplish with this series, which is identify areas in which we disagree, but also move the discussion forward by identifying areas of convergence. Not complete convergence, nothing is ever perfect, but we often find in the course of these discussions that there are some points in which everyone can agree, but we try to get there by way of having a very spirited discussion about the elements of disagreement in the first place. And so we're very fortunate that we have two totally prepared to disagree people here today, Jack Chow and Andrew Huang, to answer the following question, that the United States should press China to make the full transition from health aid recipient to global health donor. So that is the resolution. Now, the way we'll proceed is that Jack is going to argue in favor of the resolution, that it is in fact time for the U.S. to press China to become a global health donor. Andrew will then respond. We're going to start with their opening statements, followed by questions from me, and then, of course, from all of you, and then all three of us will offer our closing remarks. I'm now prompted to offer my own thoughts on this topic, but I would say they are probably going to be so less informed than the views of my two debaters, so I'm going to yield back the balance of my time and we'll plunge right into the discussion. Let me first, though, give you a little bit more information about our two speakers. Ambassador Jack Chow here on my right is Distinguished Service Professor of Global Health at Carnegie Mellon University, and he conducts that from Carnegie Mellon's outpost here in the nation's capital. He has served pioneering roles in public service and global health diplomacy. Many of you will know he was the first Assistant Director General of the World Health Organization on HIV/AIDS, TB, and malaria. He held the rank of ambassador as the special representative of then Secretary of State Colin Powell on global HIV/AIDS, and he was the Deputy Assistant Secretary of State for Health and Science, the first U.S. diplomat of ambassador rank appointed to a public health mission. He has served at the State Department as the Senior Advisor for Global Health Policy to the Undersecretary of State for Global Affairs. He was a management consultant at McKinsey & Company, a staff member on both the House and Senate Appropriations Committee of the U.S. Congress, and Deputy Assistant Secretary for Public Health at the Department of Health and Human Services. So you can see he's actually lived about 12 lives. Jack finally is also a medical doctor, having trained at Stanford. He earned his MD at the UC San Francisco School of Medicine, and also has looks like about 12 additional degrees, among others from the Kennedy School of Government at Harvard. So we're very thrilled to have Jack with us today. Andrew also, or as he is known, but Yanzhong is your formal.
Andrew is my illegal.
Your illegal name, that's right, right, exactly. The one you pass yourself off as here among us folks here. Andrew is a senior fellow for global health at the Council on Foreign Relations and has written very extensively on global health governance, health diplomacy, health security, and public health in China and East Asia. He has a forthcoming book looking at health governance issues in contemporary China, including the current healthcare reform and the government's capacity to address disease outbreaks, food and drug safety, and so forth. He's a research associate of the National Asia Research Program at the National Bureau of Asian Research and the Woodrow Wilson International Center for Scholars, and also a research associate at the East Asian Institute of the National University of Singapore. He's the founding editor of Global Health Governance, the scholarly journal for the new health security paradigm. He's also on the editorial board of several journals and is an associate professor and director for global health studies at the John C. Whitehead School of Diplomacy and International Relations at Seton Hall University. He's taught at a number of places, including Barnard and Columbia, and received his PhD from the University of Chicago. So you can see they come formidably equipped to discuss this particular issue. So, Jack, we're going to turn to you first to argue in favor again of this resolution that the U.S. should press China to make that full transition from health aid recipient to global health donor.
Well, thank you very much, Susan, and thank you to CSIS, Steve Morrison, Charles Freeman, Lisa Cardy, Seth Gannon. Thank you, the community of CSIS, for coming and hearing the argument. And I also want to convey on behalf of us our heartfelt compassion for the people in Japan. We hope our friends, professional and personal, are doing okay. I should state that the views expressed are my own and not necessarily those of the organizations with whom I'm affiliated with. I've been invited to take on the challenge of affirming this resolution, and in the 10 minutes that's allotted to me, I thought I would, the argument really cleaves into two components, the disparity of need and the disparity of the supply of aid. The global health movement is really a special mission, and that special mission is what can we do as a global community, a world community, to confront the dynamic of disease, death, and debilitation as they intersect with the forces of poverty in impoverished regions of the world. And the center of gravity of this campaign is sub-Saharan Africa. The World Bank has estimated that nearly half of the people in that region live or subsist, or I would even say endure, at an income level of $1.25 a day, basically $500 a year. 40% of the children in the region are undernourished, are underweight and underheight for their age compared to the demographic standard. And the pandemics I was tasked to confront, AIDS, TB, and malaria, when you add up the mortality statistics, 3 million on AIDS, 2 million on TB, 1 million on malaria, 6 million deaths every year just from these three diseases, on top of the devastation that is going on with maternal child health, other neglected and tropical diseases. So it is not just a turn of phrase that these are the diseases of mass destruction. These are the diseases of societal destruction. In spite of that, to enter the breach, 10 years ago, this country, in alliance with others, in the aftermath of the 9/11 attacks, embarked on signature moves in global health, adding chapters to the saga. The PEPFAR initiative, Presidential Emergency Plan for AIDS Relief, that's now operating intensively in 15 countries. The launch of the Global Fund to fight AIDS, TB, and malaria that has now garnered $20+ billion in pledges. The Presidential Malaria Initiative, also working in a stepwise, accelerated fashion, providing bed nets and ACTs in Africa. And as that trajectory was launched, as everybody knows, beginning in about 2008, the world has endured a debilitating, crippling worldwide economic recession. And that recession has produced profound suffering here in the United States, 10% unemployment, probably the next 10% are worried about their jobs, and the rest of the citizenry are highly anxious about the economic situation. Last year, the Eurozone underwent its currency crisis. So altogether, the United States, in fighting the recession, has accumulated a debt of $14 trillion. And from that deficit, there is high anxiety about the implementation of the American healthcare reform movement. You watch TV, states are struggling to cope with their deficits. Even amid this economic stress, the global health movement has continued. Secretary Clinton has launched the Quadrennial Diplomacy and Development Review, QUIDR for the Washingtonians among us, that advances the notion of developmental diplomacy. How do we assert peaceful civilian power throughout the regions of strategic interest to the United States? And in spite of the recession, the Global Fund was able to raise nearly $12 billion in pledges. The .7 alliance of smaller countries such as Sweden and Denmark, who are allocating 0.7% of their GDP to overseas development assistance. Last December, Japan launched its $3 billion global health initiative, and today I would argue that their ability to implement is understandably in question. Russia repaid the Global Fund the grants that it had received up to the recession, and the Toronto G20 Assembly declared that maternal and child health, as part of the Millennium Development Goals, is worthy of another $7 billion in pledges. So amid the crisis of 9/11, amid the economic stresses, the global health agenda moves forward. So where is the disparity in supply? The People's Republic of China, in the past 5 years, through this recession, has been able, admirably, to grow their economy by an estimate of 11.2% cumulative annual growth rate over the past 5 years. They have been able to earn an accelerating budget surplus that's unprecedented in history, and has amassed a nearly $3 trillion foreign currency reserve. And from that foreign currency reserve, they've allocated $200 billion for investment. But even with that, China has secured $1 billion from the Global Fund, $150 million to fight malaria in a region where WHO says it's a fairly low prevalence state. They recently, yesterday, earned a $150 million World Bank loan for water treatment. They have increased their position at the IMF. They have yet to declare a global health and development strategy, and we've been monitoring the annual legislative session, and there is no sense of movement from them. So the differentiation of the capital wealth position of the United States and China is $17 trillion, and that dynamic has consequences. It means that when the Global Fund, on its recent fundraising campaign, just came about $300 million short. China could have made a difference. People are concerned about the ability of the world to accomplish the Millennium Development Goals along a number of fronts. Already in the United States, there are calls from different quarters in Congress asking the administration to press China to do more. So constructively, what can the U.S. do to persuade and engage China? I refer to Jim Steinberg, the Deputy Secretary of State, had the fortune to pose a question at the Center for the National Interest, and I'm going to cover for Jim. It's not articulation of official policy, but I asked him, I said, what can China do to advance humanitarian policy? And he said, well, China has basically, I'm paraphrasing, an obligation as a global citizen that they have a stake in the solution, and that on issues such as AIDS, TB, and malaria, that they ought to play a stronger role. I believe that a framework of engagement can include the following elements: that the developmental diplomacy under Quitter ought to be multilateral and actively pursued to bring in surplus donors like China and the oil producing nations. That the U.S.-China strategic and economic dialogue be a platform for engagement with China between OGAC, USAID, and the Global Health Coordinator with their counterparts. That there be a trilateral approach, that the U.S.-China works together in regions like Africa. That there be a package of technical assistance from the U.S. to China on biomedical research, on epidemiology, and science policy. That Ambassador nominee Secretary Locke, if confirmed, can bring this agenda directly in Beijing. And that what we're seeking is an outcome that China refrains from taking more global help, the Global Fund grants, allowing those resources to flow to the neediest countries, that China seeks a target, an ODA target of maybe 0.5% of GDP over the next 10 to 20 years, that it repurposes some of that money. It had a stimulus package of $586 billion, of which $27 billion was dedicated to health system upgrades. That if there was rounded up to $30 billion, I think we wouldn't be having this conversation today. That China formulates and declares a strategic goal, and a strategic goal has three essential elements: a finish line, a verifiable finish line, a timeline, and a headline. What is the declarative value of their actions? And that it works in compact with the global community in implementing emergency assistance in regions such as Africa and Haiti. And then finally, that it ups its contribution to the multilateral constellation of agencies such as WHO, UNICEF, UNDP. So with that, I believe my 10 minutes is up, and I'm welcome any queries at this stage.
Terrific. And at this point, precisely, we do that. Andrew, we give you the opportunity to ask questions of Jack.
Thank you, Susan. Thank you, Jack. And before I have questions for Jack, I'd like to thank CSIS for inviting me over, and thanks to Steve and Chow and SAS for making that very considerate arrangements. I'm honored to be here. Before we get started, I have to admit that I'm not good at debating polemic topics. The last time I had a formal debate was 23 years ago when I was...
You clearly don't have children.
I do. When I was a sophomore student, we were debating like whether China should have a shock therapy or not to reform the economy. And I lost it to a freshman. And I have never been a diplomat, so forgive me if sometimes I'm not that diplomatic. But I think this is a very good intellectual exercise. I'm asked by SAS to be in that position, but don't mistake me. I'm not either. I'm not a panda hugger. I'm neither a dragon slayer. So. Well, I do. After hearing Jack talking about the need for U.S. to press China to make the transition from health aid recipient to global health donor, I do have a question. What do you mean by forward transition? And how do you characterize China's status would you think that view China as an aggressive health aid seeker or a passive involved in global health or a passive global health donor? How would you characterize China's status?
It's an excellent question, Yanzhong. I would have a series of milestones that would define that transition. I enumerated some of them, which is to stop taking global fund grants, to start donating to the global fund. Right now, their donation rate is $14 million over 5 years. Certainly, that could be up. I would have a suggestive goal over the next 5 years of having China donate $100 million a year. All they have to, well, from the interest off the CITIC of $300 million, they could easily cover this. And that I would note that Jim Wolfenson, the past president of the World Bank, is on the CIC International Advisory Board. So I would see that as a positive sign. Other milestones is that we'd like to see China perhaps develop a Chinese version of USAID, CHAID, right? A Chinese Agency for International Development, staffed with professionals that would organize and coordinate and be the nexus for interactions with our USAID and DFID. In terms of country operations, China could certainly contribute technical experts, primary care physicians and nurses that work in concert with PEPFAR and other bilateral and multilateral organizations. So those are some of the tangible operational objectives that I could see that could be embarked upon. Again, I am not here to indict China and say, I'm here to catalyze that dialogue and give encouragement to China, because we need China to be part of the global health story.
Andrew, do you have another question? I'm not sure. It may have been that Jack, did he answer the question you asked? Because it seemed to me you were asking something different, which is how would you characterize this unusual situation China is in at the moment of being, on the one hand, and as we know, heavily investing in African countries in many other respects, building roads, et cetera, building hospitals in some cases. So it's a donor and a taker at the same time. Was that the direction you were going in? Yeah.
But Jack did answer my question, what exactly that what transition means. But I'm still curious whether Jack would agree that China is. He seems to imply that China is a very aggressive health aid seeker. Is that
my interpretation? Having worked at WHO and working with health ministries are typically underdogs in their budget battles. My role is to bolster them, help health ministries produce the outcomes that allow them to win the budget battles in their home governments. I believe, and I have no direct evidence, but just from my WHO tenure, that China's Ministry of Health is in a similar situation, that the hard power agencies are getting the lion's share of budgetary resources, so that the ministry has to go out and get business on their own, win the grants on their own. And I think that's a question that's placed to the ministry themselves. And I've enjoyed my quarrel is not with the health professionals of China, and I've worked with them throughout. But I think this dynamic is what is causing them to seek to pull money from the international system.
So it sounds like, if anything, you would characterize them as a reluctant aid seeker, forced into that of necessity because it is a soft power agency, the Ministry of Health. Is that fair? Okay. All right. Well, we are going to move on now to Andrew's opening statement, and he has 10 minutes to set forth his feelings and pronouncements on the other side. So, Andrew, over to you.
Okay. Well, thank you, Susan. Actually,
as I told Seth before we had this debate, Jack and I, we had a lot, we agree many fronts, so that is what make this debate sort of
Don't
difficult.
get there yet.
All right, but we do agree that, I agree with Jack that China should chip in more in global health as it becomes richer, because that is good for global health governance, that is good for China's own international image. We also agree that China should be encouraged to play a more prominent role in global health, and the United States could play a constructive role in working closely with China toward this direction through channels such as strategic and economic dialogue. But that being said, I do have some issues with Jack's arguments. First of all, let's get the facts right. Foreign exchange reserve, well, we know China has 2.5 trillion foreign exchange reserve, but foreign exchange reserve is not a good way of judging a country's development level. Right? If you look at the 20 countries with the largest foreign exchange reserve, 6, including China, India, Indonesia, Algeria, Thailand, Brazil, continue to be recipients of Global Fund money. A more useful predictor is the GDP per capita. Right? If we plot the per capita GDP against the share of ODA, official development assistance, in GNI, gross national income, there is actually a very strong correlation between the two. That is, the higher the per capita GDP, the more generous a country will become in providing development aid. So it is not surprised that Norway, Luxembourg, and Sweden, they spend a larger share of their their gross national income on official development assistance. Right? Let's look at China. Right? In terms of per capita GDP, China continues to have a very low GDP per capita. Right? The more recent data suggests that its GDP per capita is about $3,400. That is significantly lower than the world average, which is $9,000, and even lower than South Africa, right? And Botswana. Right? And also, what Jack mentioned, there are people who in sub-Saharan Africa who are below the poverty line. But keep in mind, China has between 130 to 160 million people still living below the World Bank designated poverty line. And also, if you compare, look at some of the Chinese provinces. Right? Each province, in terms of land mass and its population level, it's like a middle-sized country, right? So I found it, instead of comparing China directly with other less developed countries, why not compare these Chinese provinces, especially poor provinces, with those countries in sub-Saharan Africa, right? I have the data here. Right? Some of the Chinese very poor provinces, including Guizhou, Gansu, Yunnan, and Tibet. Right? They just give you an example. Guizhou, it has a GDP per capita of $1,500. It's a population of 38 million people. Right? It is poorer than Sudan, right? Or Guyana. And if those countries like Sudan, South Africa, Guyana could be legitimate recipients of health aid, why not these poor Chinese provinces? Right? And if you look at also the Chinese health disease burden, right? Despite those progress China has made over the past decades, China continued to face a huge, actually growing disease burden. I'm not going to talk about the chronic non-communicable disease, just to focus on the infectious disease. HIV, China has 740,000 HIV carriers. The seroprevalence level is not that high, 0.06%, but 56.8% of people who are infected do not know their status. So that means that the HIV is spreading quickly from high-risk groups to the general population. Let's look at TB. Jack just mentioned that in sub-Saharan Africa, there are 2 million people suffering the tuberculosis. But in China, it has the second largest TB population in the world, right? Trailing India. Right? It has 1.3 million new cases of TB each year. What about HBV, a hepatitis B virus? China has 130 million people carrying the HBV virus. That amounts 1/3 of the world total. Okay? And these disease challenges pose a big challenge to China's health system. Right? Actually, based on the 2-week morbidity rate in 1998, one study predicted that between 2000 and 2025, the number of the patients are going to increase by 70%. The annual outpatient visits, or the people who are hospitalized, going to increase by at least 40%. And the medical spending is going to increase by at least 50%. So that is a huge challenge to China's health system, right? Capacity. Let's look at the health system capacity. Does it have that capacity to weather that challenges? Right? Unfortunately, despite the fact that China is getting richer and the central state coffer is expanding dramatically, right? There is a central-local gap in financing healthcare. This is if you look at the local level health financing, the 1994 the tax reform actually make things even worse because it re-centralized the fiscal power but decentralized the fiscal responsibilities. So the central government scooped most of the lucrative taxes and leaving the local governments with very low revenue bearing taxes that were costly to collect. Right? And that problem was even more precarious at the sub-provincial level. So decentralization has not led to a U.S.-style federalism, local governments focus on police power. It actually has increased the burden of local governments by shouldering them the responsibilities of promoting local economic growth and public goods provision, including health care provision. Right? And with GDP still the yardstick to measure their performance, the local government officials, these cash-strapped local governments, have few incentives to adequately finance health care. And to reflect that marginalized status of health care in their agenda, the government health spending as a percentage of total health expenditure actually dropped from 36% in 1980 to 25% in 2008. Right? So you see that while China is getting wealthier, so richer, that has not been translated into similar health system capacity at the local level. Right? And this happened at a time when this growing disease burden reduced the state capacity when ever-increasing capacity is needed to tackle the challenges. Right? So if those purely endogenous solutions to build capacity is unlikely going to be successful, right? That capacity has to be imported from exogenous sources like massive foreign aid. Right? And pulling having a full transition to the donor status is not going to lead to increased health spending at the local level. Actually, it's going to do more harm than good if we consider all these positive benefits the massive foreign aid, especially health aid, has done to the Chinese health system capacity. So my argument is different from Jack's. That is, I think it's not a good idea to seek a full transition to a global health donor status at this moment.
All right, now we turn to a similar opportunity that we now give Jack to ask questions of Andrew based on what he has just said.
Thank you. Thank you for your very thoughtful exposition. You mentioned the GDP numbers being fairly humble. And I think China lives under the tyranny of the large number. That any asset divided by 1.3 billion people will yield a low number. So by that line of thought, for China to reach a metric in which it could enter the pathway of being a donor, the GDP would have to be in multiple trillions of dollars if it were to be divided by 1.3 or 1.5 billion. So it's, again, we're debating statistics, but let me focus, I'd like to get your reaction to that.
Oh, you want? Well, I agree that because this is just a too big a country. Well, the Wen Jiabo actually mentioned in Harvard that a big problem is divided by 1.3 billion. It's a small problem. Right? If it's multiplied by 1.3 billion, a small problem can become a huge, humongous problem. But I agree that that is the issue. But this is not my intention to say that China has to reach this to be as rich as the United States to be a global health donor. Actually, if you look at the trajectory of those global health donors like Japan and other countries, you don't have to be as rich as the United States or other developed countries to be a matured global health donor. And I still have some data, like Japan, for example, they joined the club of donors in 1954 when its GDP per capita was just 30% of the U.S. level. Right? Russia, that you just mentioned, that seems to be very aggressive in becoming a global health donor, but it is a country with GDP per capita that is more than twice higher than China, and it is categorized as an middle income country, by the way. And China's GDP level today is only 10% of the U.S. level. So my point here is that we should give it more time. We should be more patient. It doesn't have to reach the U.S. level of the GDP per capita in order to be a full global health donor. But at least we should give them more time.
And Yanzhong, if the trade, if the foreign exchange currency reserve is not an issue, or it's a minor force in your outline, then at what level do you think would trigger them to be a donor? If you're saying don't be a donor at $3 trillion, what level do you think they could do it? At $10 trillion? I think there's a political dynamic here of the optics that they built basically a Mount Everest, mountain-size cash reserve. In fact, they own half of Mount Everest. That is heavily invested in U.S. treasuries. So you have this dynamic, and this is an American-centric proposition, of Americans who lost their jobs because of this bilateral trade relationship. They're paying the interest on the debt that we owe to the holders of and we're exporting money to support their health systems. So where's the equity in this?
Well, Jack, it seems to imply China is a passive global health donor here. That and actually, if we look at the history, well, China has been actually a very aggressive donor nation had been a very aggressive donor nation until the 1980s, believe it or not. For a long time, China was very generous provider of development assistance to the third world, of course, for political reasons. And actually, even during 1958 and 1961, when 30 million Chinese lives were lost in the famine, China was still sending, that was a ridiculous thing, was still sending money and food to other countries, including Albania. The foreign aid to the third world increased in the 1960s and through the 1970s when China felt impelled to support the decolonization movement and called the support of the third world countries. So Chinese development assistance as a percentage of fiscal spending actually increased to 7.2% in 1973. That was higher than most developed countries at that time. And it was only in the 1970s, when there was the agenda shift, and then they reassessed the China's foreign aid program. they draw some very important lessons for the China's the foreign aid experience. Basically, they learn from that experience that the amount of foreign aid should match the domestic development level. There are limits of using foreign aid as a foreign policy instrument. You cannot use foreign aid to buy friendship of those countries. We all know that Vietnam, Albania later become sort of like, especially Vietnam, enemies of China, even though they pumped, a tremendous amount of foreign aid. They also learned that the foreign aid, if it's pursued, should be mutually beneficial process. So eventually, with this growing burden of in providing foreign aid and the West and abuse of the aid by the recipient countries, China reduced or readjusted the foreign aid policy in the 1970s. That led to a significant drop of foreign aid as a percentage of the fiscal spending. So I believe there's a reason for China to be hesitant in being a full, what Jack defined, a full global health donor, because that aid philosophy, that policy adjustment that did the 1970s still pretty much affected the thinking of the Chinese policy makers.
Great. Well, we've heard now these two arguments laid out. Jack's essentially being, look, judged by a number of metrics, China's a rich country. It is still receiving money, obviously, from the Global Fund for certain areas, but it really makes no sense judged against China's enormous increased wealth in recent years. And China really needs to step up to the plate and play a stronger role. And he laid out a series of metrics for that, things that China could begin to do, whether it was raising contributions to UNICEF, developing a Chinese equivalent of USAID, course, stop taking the Global Fund grants and start becoming a Global Fund donor. Then we heard Andrew's set of counter arguments, essentially that some of these metrics about foreign exchange reserves, et cetera, are misleading, that a better measurement is GDP per capita, and he acknowledged that because of the 0.3 billion denominator, that it tends to lower the per capita amount, but nonetheless China is overall still a poorer country, particularly when you look at the situation of the poorer provinces and the populations in those poorer provinces. He mentioned the growing disease burden that China faces itself in HIV, AIDS, TB, and he didn't mention the non-communicable disease burden, but that is also quite enormous. And so given all of this, and given that China is still working through the internal wrangling over how revenue is going to be collected centrally and dispersed among these poor provinces in particular, it's not a good idea to lean on China too hard at this time. So that's essentially his argument. So let me go back to you, Jack, and ask you, so you heard Andrew's perspective, really, and I will add to that we know that there are 300 million Chinese without health insurance. So China has the uninsured equivalent of the entire U.S. population, in effect, without health insurance. The country is undertaking very aggressive health reforms to try to cover more people itself and radically raise the level of services provided, especially in the poorer provinces. So the argument essentially, as Andrew said, is they've got a lot of their own knitting to attend to, and maybe for the stability of the world, not to mention the well-being of the Chinese people, it's better to cut them some slack for the moment and let them expend more resources on their own population, as opposed to requiring them to become a large global donor at this point. So how would you respond to that?
There's not enough time for the people in sub-Saharan Africa who are on the precipice of death, disease, and debilitation. PEPFAR was launched as an emergency plan to rescue as many men, women, and children who lack ARVs, who lack tuberculosis drugs, who don't have access to bed nets. So for the argument to say, oh, we can afford to wait, means a tragic outcome for many talked about the knitting. It seems there's a country that can buy a lot of yarn. There's been identified provinces in China and large swaths of population who are uninsured. And the English translation of the stimulus package, that $586 billion, indicated that China was about to spend $125 billion to cover 90% of the population in rural regions. We hope that they implement that. There's obviously some budget disconnect in the China political ecology that they took $200 billion from their foreign exchange surplus and put it into the China Investment Corporation. And in 3 years, they grew that $200 billion to $380 billion, investing in American and European companies. That $386 billion is now about 5 times the size of the Gates Foundation. The interest on that $380 billion, or the earnings, could have easily been dedicated to social investing in China, or to supplement the budget of these provinces. So now you have the dynamic, the pathway, in which China is now the 4th largest recipient of Global Fund grants. It has earned more money from the Global Fund than South Africa. If President Bush were to learn, at the genesis of donating funds to the Global Fund, and said, Mr. President, we're going to create a Global Fund to confront disease in Africa. Oh, and fast forward 10 years later, the 4th largest recipient will be a country with $3 trillion in exchange reserves. It's speculation, I would predict that initiative would have been truncated. So at the time of PEPFAR and the Global Fund, the world was very different. The economics, the relative status of these countries were different. So in the past 5 years, that has been radically transformed. So there's an opportunity. You've laid out the gaps, and I'm saying China has the wherewithal, the resources. It takes the willpower and the friendly nudging of the United States, this administration, the people of the United States, Congress, to say, hey, look, we need you as part of the alliance. We need you as to be a part of the coalition of the caring and concern. And this trajectory only makes the situation in sub-Saharan Africa worse.
Okay, well, thank you. Well, Andrew, to turn over to you, in a way, Jack is being very diplomatic and polite, but if I could take the journalistic approach and sort of distill down what he's saying, he's more or less saying, look, Andrew, just because China runs a completely screwed up fiscal policy and a completely manipulative currency policy, and has accumulated these huge reserves, and as he says, using them to invest in international companies, and neglecting, in effect, the poorer provinces, and reducing a large portion of the Chinese population to much lower standard of living than is the case in the coastal regions. Just because China elects to do all of that doesn't mean we should excuse them from the investing and assisting in other areas of the world where the emergencies are quite dire, specifically sub-Saharan Africa. So that it is not a reasonable excuse to say, good, China, take 10 or 15 years to sort yourselves out, bring up the standard of living of your own people, and then we'll let you off. We will not only stop giving you money from the Global Fund, we will expect you to be a net contributor to the Global Fund as well as to other international assistance efforts. So how do you respond to that?
Well, Jack is, of course, always very diplomatic. Thank you for also presenting your journalist perspective. I'm going to present my scholarly perspective. I think this might be blunt. I think China should not be blamed for other countries' predicament. China, for example, they apply for and being awarded the Global Fund money, well, they went through the same review approval process, right? That the same standards apply, and they implement those programs, those grants with A ratings, so they are eligible for continuous funding, and we can't blame them for that. And if do that, we're going to punish the winners. Right? Also, did China move the other countries' cheese? If you look at the OECD data, right, 113 countries received the Global Fund money, including 33 countries whose GDP per capita is higher than China's. And China receives a total Global Fund money of 1 billion, if we count the 2010 data, of course. That is higher than four countries. But if you divide, again, this is the tyranny of large numbers. If you divide it by 1.3 billion, that's only 32 cents for China. That is significantly lower than most recipient countries, including South Africa, which got 3.74 in terms of the Global Fund money per capita. Congo, Tanzania, Ethiopia, Nigeria. It's even lower than India's. Right? China is not an aggressive seeker of the health aid, and it won't be very fair to blame China for problems of other countries. And I think there's a solution. The solution is not to press China to significantly increase its global health aid, but to ask those OECD countries, including the United States, to fulfill its political pledge of increase its the development assistance aid to 0.7%, the level that they pledged. That is the development aid as the percentage of the gross national income. Right? Jack, you mentioned the QDDR, right? The purpose of the QDDR is to call for leading through civilian power, to address the global problems, right? It presents in my opinion, serious approach to project and improve the U.S. soft power. Right? And if we are even debating here, unfortunately, this is happening in the Congress, whether to cut foreign aid, I think this is sending a bad message to the developing countries. It also makes our policy look less coherent.
Okay. We're going to open this up now to questions from all of you in the audience. While we're waiting for someone to ask a question, and let me also add, if you would, identify yourself by name and affiliation before you ask a question, that would be very helpful. But let me just give Jack a brief opportunity to respond to what Andrew just said, particularly on this point about confusion of objectives on our part in the United States on what we really want China to do.
Well, there is a critique of the Global Fund's policy of eligibility criteria. That would probably take another debate. I believe that the administration can do more to tighten and clarify the eligibility criteria at the Global Fund. I have yet to see that happen in a real tangible way. I hope that the diplomatic team will start to take to heart this dynamic where it's not only China, but others that are taking grants that subtract from that could have been dedicated to the most impoverished regions. Again, I focus on China's budget ecology, if you will, that you've laid out the gaps. Why can't the budget system, and China's now going through its annual legislative session, why can't they are able to invest domestically to the extent that it doesn't have to draw upon the global fund. I mean, that seems to me, where's the disconnect? Where is the policy architect who can say, I believe these provinces deserve more funding. Let's mobilize, whether it's from the CIC or the internal regular budget process, sufficient discretionary funds to these regions, thereby relieving and allowing China to do more on the international stage.
What your response?
So I agree with Jack that there should, in terms of the fiscal spending, the structural, the public finance in particular, they should restructure the central-local relationship. If you want to shoulder the local governments with with all the responsibilities, you have to give them the full adequate financing to get the job done. Unfortunately, that is not happening today. And in fact, China, well, that's the hurdles, that preventing China from chipping more to global health. That so far it still attaches more importance to domestic issues. According to the senior Chinese health official last year, I quote him: China is still a developing nation, and its social economic development are still facing grim challenges. So China would make itself would make significant contribution to global health if it could address the major public health problems of the 1.3 billion people of their own. So, and of course, what is happening in the Middle East actually would make, I believe, even more difficult for the government to change that mentality, because it highlights the importance of tackling domestic issues. We know that there was a study, Chris was there. Last time we mentioned that study by Ted Gurr, Robert Bates, and others, basically found a strong correlation between infant mortality rate and political instability, including disruptive regime transitions. And actually, China has an infant mortality of 18. That is very close to Egypt, Tunisia, and higher than Libya. So if the central leaders were reading I hope they got that message. Well, I hope they didn't, actually. They would think, I better have to invest more in my domestic, the health system. Otherwise, I would be in big trouble.
Okay. So are there questions for these folks? And please identify yourself again by name.
Hi, my name is Mark Isaac. I'm working with Friends of the Global Fight here in Washington. And I just wanted to direct a question to Ambassador Chow as to whether some of the things that he's been suggesting should happen may actually already be in process. And by that I mean, for example, that in round 10, which the Global Fund was making its latest round of grants, only $15.7 million was devoted to China, I believe, for a grant that actually will take place entirely in Burma, I think, across the border in a section of Burma. And as well, as I think you alluded to a moment ago, the Global Fund Board of Directors is working on eligibility changes that are intended to direct more of the funding away from middle-income nations, such as China, perhaps to focus more on the poor nations. And the Global Fund spent, as I understand it, tremendous amount of time and effort to try to convince China to up its donation. So this is along the lines, I think, of what you were addressing a moment ago. But what needs to happen politically right now, in addition to what's already occurring, to make these things that you're talking about come about?
Good to see you, Mark, and thank you for the update. And I think these steps are very helpful. I'm not saying that they're not. In terms of some tangible action at the Global Fund, they would escalate their pledge. And structurally, I would like to see China change its board seat category from an implementing country to a donor country. That would be a very positive signal to the world community that it is taking to heart the forces that I just described. And it would actually change, for those of us who have been involved in the Global Fund, would positively affect the dynamics. China, as a donor board seat, would be contributing to thinking through the operating architecture of the fund.
Now, that seems like a fairly modest proposal, Andrew. Would you go along with that, that at least symbolically China should declare itself a donor, maybe beyond symbolically, stop taking the money of a recipient country, an implementing country, and become a donor?
It is a donor, actually. It is actually, well, the situation for China is both a recipient of health aid and a donor of the global health, the foreign aid, related foreign aid. If like Wen Jiabao, the Chinese premier, announced the closing of the summit, the UN summit, and China's commitment to contribute the US dollars, $14 million to the Global Fund within the next 3 years. That was actually almost the total amount China pledged to the Global Fund money over the past 7 years. And that actually makes China a top donor among all the developing countries in contributing to Global Fund. Because if you look at India, I was perusing all those the Global Fund third voluntary replenishment, the pledges for 2011, 2013, right? India and Brazil did not contribute a dime. Right? South Africa contributed $2.1 million. And Wen Jiabao is even more interesting. Wen Jiabao announced plans to build 200 schools, dispatch 3,000 medical experts, and train 5,000 local medical personnel, and provide medical equipment and medicines to 100 hospitals. And all this, I think, is a good sign and suggests that China, or that process has already started for China to become eventually a fourth donor.
Actually, Mark's question crystallized. There, that I remember that there is a clause in the Global Fund policy that was enunciated fairly recently. Whether it's formal or informal, we'd have to look into. But it was declared that there would be a policy of countries such as China being a net beneficiary. That if you divide the $1 billion that they've already gotten by the run rate of $14 million, or whatever, $3 million a year, there's actually no intention for China to ever become a net beneficiary at this rate.
A net beneficiary or a net donor?
No. The intent is to allow countries such as China to remain a net beneficiary.
Right.
So they've gotten $1 billion. They're paying in $3 million a year. So you do the math.
Right.
Unless that trajectory changes at that run rate, they will not become a net donor.
Right.
Actually, Jack, I would disagree with that. I believe once China had fixed its own domestic health system, and once that the mentality, the philosophy has changed, we would expect a significant contribution for China to contribute to global health. In fact, is Catherine here today? No. The CSIS released they released a report a couple of months ago that it's entitled "The Key Players in Global Health," right? Right. Yes. Actually, one of the crucial message, actually, I found it very interesting, is that the government's motivations for becoming involved in global health policy debates and cooperation programs vary and depend to a large extent on domestic health and political conditions. So I'm optimistic that in the not long future that China could become a significant donor nation in terms of global health.
Let's move off of the subject of the Global Fund for just a moment. I'll come to this question in a moment. I just want to quickly ask some of the other gestures that Jack indicated China could take that would be important symbolically and substantively. Developing a Chinese equivalent of USAID, upping its contributions to UNICEF and other assistance organizations. What would be wrong with that, particularly, again, given however we want to characterize China, it's hard to characterize it as a poor country anymore, notwithstanding the fact that it's a developing country with a lot of poor people and an emerging power with a lot of poor people in it.
Well, I think this is a good advice. In fact, I was, Jack, you knew that, actually suggesting to the Chinese government that you should probably have the U.S. equivalent to the USAID to be in charge of those the foreign aid and development assistance, and currently that is it's a very fragmented structure. That's authority or the responsibilities scattered among different bureaucracies, including Ministry of Health, the Ministry of the Commerce, and the very powerful National Committee on Development and Reform, NDRC. Actually, there are also many Chinese researchers, scholars are campaigning for that. The problem here is still, I think, one of that is the political. The China, I believe it would be unrealistic to expect Beijing to significantly increase its financial contribution to global health when Beijing still view the demands for China to shoulder more global responsibilities sort of as a conspiracy to slow down China's growth, to contain China's rise. That was actually one of the political hurdles we face, changing that the structure. And
But 0.5% of GDP is hardly going to slow down China's rise substantially, right? And that was the threshold that Jack was suggesting be aimed at.
Now, I'm not disagreeing with Jack about the actual numbers. It's here I'm talking about the political hurdles. If the mentality is still there, if the policy makers, decision makers, they are convinced, and all those pressures, those talks about China shouldering more responsibilities, it's just a conspiracy, right? Or in their words, these request to ask China to take more global responsibilities and obligations do not match China's power status. They only exaggerated China's power and influence in an attempt to shirk the Western so-called developed countries' responsibilities, while at the same time trying, in their words, sowing the discord between China and a large number of developing countries.
Okay.
That makes it difficult.
Let's go to this question here, and then we'll come over here.
Hi, I'm Shelley Bressler. I'm with the Senate Foreign Relations Committee on the Republican staff, and I do global health. And one of the issues that hits me when I go to these African countries is they show off the brand new Chinese soccer stadium, or they show off the brand new Chinese performing arts center for a country that doesn't have steady forms of electricity or a literacy rate above 15%. Or they have a brand new road. And not only that, is all the workers building these projects are imported from China. So it's not even making jobs in the host country that is the recipient of this. China's paying for this. They're providing the labor. They're providing a lot of times the earth-moving equipment that doesn't exist in these countries. How can they justify investing in that and then claim poverty that they can't invest in global health? And they are starting to do a little bit more, but the main projects that have been very, very expensive have seemed not to have been health-related, and also not investing in their own people and saying that they need the money from all different type of multilateral organizations when they're spending large sums of money abroad on non-health-related projects.
Cantor.
Well, there's some fundamental difference between our way, the American or developed countries' way of foreign aid in Africa and the Chinese way of foreign aid. We know that the Chinese, the foreign aid, the government does not give the details about its aid programs in Africa, but we know that half of that was categorized as so-called free aid. No political strings attached. They tend to be bilateral. They also, but different from the programs and other implemented by other countries. These programs tend to be fast, efficient, and in a way also effective. I actually might have to disagree with you that you said China has not contributed significantly to significant health aid to Africa. That is not true. Actually, China, for example, continued to pursue health diplomacy in Africa as the cost-effective foreign policy, foreign aid instrument. By the end of 2009, for example, China has sent a total of 17,000 medical personnel to 47 African countries and regions, and served some 240 million people. And more recently, also China has pledged to build 30 hospitals and provide the U.S. equivalent $37.5 million in grants to supply those anti-malaria drugs and develop 30 malaria prevention treatment centers in Africa. So indeed, it is doing a lot there. But the problem is the lack of cooperation. Firstly, there's a fundamental difference in terms of the approaches. And secondly, there is a lack of cooperation between China and the United States and other countries in providing health aid in Africa. And I believe this is the area that we could encourage and promote.
The multilateral.
Multilaterals, yeah.
As I believe Jack said earlier. Okay.
Yeah.
Let's take a question here.
Bristol, I'm a freelance journalist. Given the threats to the U.S. foreign aid budget and the cultural differences between China and the U.S., does the U.S. really want China competing with it more heavily in this area on the world stage?
Jack?
I wouldn't frame it as competition because I think this is a mission of humanitarian importance. As when I was asked, should we wait? When you do the math of 6 million people dying from AIDS, TB, and malaria, it implies that every day about 20,000 people are dying from just those three diseases alone. So to help rebuild health systems in these countries, I don't think it's really competition. I think America would welcome an additional contributor based on both absolute and comparative advantages. The United States has a very strong pharmaceutical biotech industry. We have high rates of high numbers of well-trained individuals. China has pioneered much in the realm of primary care. They helped develop the artemisinin, the raw ingredient that is the basis for the ACT medicine, which is absolutely transforming malaria treatment. So I would reframe it as America would welcome. I don't speak for the administration, but I sense that the American people will welcome a contributory China working in concert with our experts.
We have a question here, and then we'll come to the rear.
My name is Yuxuan, and I'm actually a sophomore in George Washington University, and my major is international affairs, concentrating on global health. And actually, my question will come from a student perspective. My first question is there any possibility that encourage China to take a mid path, which means not emerge China to become a donor quickly, but encourage China first become a self-sustained country in the health issue? And also, my second question will be, do you think is there any other things make China is not ready to become a donor instead of not willing to become donor?
All right, so let's take the first question, which to paraphrase would be, what if China just said, okay, we're going to stop taking global fund money. We're not ready to be a much greater donor than we are now. Give us a few years, and here's a plan for us to become more pronounced donor in the future once we've dealt with some of our domestic issues. Jack, could you live with that?
I think China has the financial wherewithal to address its domestic health needs and still supply, whether it's financial or technical or health workforce, contribute to the alliance of countries that are operating in these regions. It was mentioned that in some countries they're actually building construction projects. Well, why couldn't, instead of building sports stadiums and art centers, they could be building clinics and hospitals? It seems to me that there is a challenge of policy architecture and basic vision that, if judiciously applied, can liberate resources domestically as well as have a contribution internationally. China has just now is now has the third largest voting power in the IMF. They actively sought this. They want to contribute to the international stage. So if you go to the next level, say operationalize that, work in these countries, build the hospitals, build the clinics, build the road connectors, that can be done.
So it's
just as
no middle ground here. Time to really convert yourself into an international donor, not just a net.
This
donor.
country, the United States, after 9/11, through the recession, still accelerates its commitment. The Global Health Initiative authorized at $60 billion. We have done it. We have actually gone deeper into debt to help other countries. So here's
Not yet.
we have other countries in the international community that are in a relatively stronger financial position that hesitates to do modest amounts in this endeavor.
All right, and we had a question back in the rear.
Mike Engelgau from the Centers for Disease Control and Prevention, and working in global health, focusing on non-communicable diseases, which is a huge issue now for China. My question is a little more broad than that, though. I'm trying to get my head around the politics here. You have a country, an economic power, recent state visit here to the U.S., on the one hand, and on the other hand, they're a recipient nation for these kinds of programs. How does the internal politics, what is the political space that can allow for what seems to be discordant, where you have this image of a power, economic giant, yet at the same time are recipient of global aid? And then related to that, how much of that is due, and I think Jack alluded to this, that the ministries of health and the leadership for health in the country may not have the influence they would need to have more in the health arena to move forward on some of these issues.
Andrew, without giving us what appropriately would be a 5 or 6 day disquisition on Chinese politics, could you address the first part of that question in particular? What creates this rather anomalous situation where there are these enormous resources, there has been a lack of investment internally, and there is this strange external policy of being a donor but also being a taker of aid. How does all that work?
Okay. Well, we have to keep in mind, if you look at the history, right, the China that for a long time was not a major recipient of foreign aid. In fact, for a long time, except for the Soviet aid, they refused to accept foreign aid. During the Tangshan earthquake in 1976, for example, all the international organizations in foreign countries promised aid medical supplies to China. Just as China said, no, we don't need your money, we don't need your equipment, we don't need any of that. We can do it all by ourselves. And actually, China, that did not change until 1979, to be accurate, until 1987. Right? So in the 1980s, it began to receive aid from developed countries, including ODA from Japan, and international organizations such as WHO, World Bank, UNESCO, they all provide, and later Global Fund, they all provide health aid to China. But China's acceptance, basically, of foreign aid was not routinized until late 1980s. So that was basically the history, right? That China's history of receiving massive foreign aid did not occur until late 1980s, actually 1987. So it's just, we talk about 23 years of China receiving foreign aid. And while in the meantime, as I said, it is already an active donor in terms of global health, especially when we talk about its health aid to Africa. So this is the transitional stage, and we should be a little bit more patient, allow actually the China eventually to complete that transition from a recipient to donor nation.
Jack, did you?
I think Mike's question is quite profound, which is basically the question, how can health ministries be effective players in political ecologies? And I alluded that in my time of service at WHO, bolstering health ministries was a core part of my mission. I believe we have to train. Now, those who become health ministers, doctors, being in medicine and public health is a technically demanding profession. And as you rise up through the ranks, you're very specialized. But you may not have the skill set to bargain with versions of OMB. So I believe that one agenda in the future is how can we train promising health ministry officials to be better bargainers, being able to crystallize strategic goals, and being able to be persuasive and attract the requisite funding.
We are getting close to the end of our time, so let's just take, if we could, just one more question, and then we'll go to final statements.
I'm Jean McDermott from the Fogarty International Center at NIH, and we run research training programs. So I want to just follow up with Jack's last comment and ask him if he would see that supporting training for those kinds of people, is that a legitimate product for China to be a recipient rather than a donor?
Absolutely. And in the spirit of full disclosure, I used to work at Fogarty. So this advancing bilateral biomedical research ties is a very important function in bolstering, being able to train scientists how to use the scientific method, how to set up laboratories, how to collect data and articulate it, and hook it to a public health mission is a valuable and noteworthy work stream.
All right. Well, we're now going to move to closing statements from both of you. And you both did such a marvelous job of laying out your initial statements that I would ask you not necessarily to repeat those verbatim now. Perhaps you want to give a very distilled version of that, but let's close by acknowledging what that the other person said you could go along with. What specifically could be a way forward at this particular juncture, given the state of the U.S. finances, the state of the global threats that we face in terms of international health, and the desire to move forward in a constructive way with the Chinese relationship. So since Jack started, Andrew, I'm going to turn it over to you for your closing statement first.
Thank you, Susan. Thank you, Jack. I actually, I agree with Jack on many fronts, and I think we have no problems that China should chip in more in global health, and the United States could play a constructive role in that process. And we also agree that China should invest more in its domestic health system, and a trilateral, multilateral approach would be the ideal approach in terms of cooperating with China in that toward that direction. So the question is how to achieve that transition. I'm instead of arguing for a quick haste approach. Basically, my argument, we should be a little bit more patient, giving China more time, and in fact, I also focus on the importance of focusing on encouraging more investment in domestic health spending. Because if, according to, as Jack has suggested, the reason for China's active pursuit of health aid is political, that is, the Ministry of Health has very weak bureaucratic status, then why not encouraging China to invest more in domestic health sector so that the Ministry of Health reduced incentives to pursue foreign money? So that is one. Secondly, I would ask the United States to chip in more, and especially to fulfill its pledge to develop development aid to 0.7% of the gross national income, because so far we only reached 0.21%, and nearly 20% of that goes to the building of the post-conflict rebuilding of Iraq and Afghanistan. So by raising the U.S. ODA with $67 billion to reach 0.7%, there would be plenty of money available for achieving global development objectives. And thirdly, I think we should encourage and promote the dialogues with China on international development issues and projects, including discussing policy, potential collaboration, encouraging more transparency. And thirdly, I think in terms of these priorities of foreign aid to China, I think we should not just focus on certain salient or sexy infectious disease like TB, HIV or malaria, but also focus on those infectious diseases such as tuberculosis, hepatitis B, and also focus more on non-communicable chronic diseases. So there should be a lot of potential for the United States and China to collaborate on this in those areas.
Okay. And the last word then goes to you.
Well, thank you, Susan. Thank you, Yanzhong. I'll build on the platform that you just laid out because I feel I can agree with much of it. Instead of chipping in, I believe America and China should be shoveling more in, but that's a matter of semantics. The global health diplomacy is enlightened statecraft that catalyzes mutual pursuit that a healthier world is a safer world. And that, as I described earlier, the global health diplomacy movement has many chapters to go. So I would like to see the next chapters of global health diplomacy on China to be filled with great stories rather than a series of blank pages, which seems to be the trajectory that we're on. And to use this metaphor even further, the global health journey is not even at the fork in the road. We're on the wrong road. We're on a road where China depletes funds from the international community. It's creating divisions and questions from the Congress and from civil society and the NGOs about the equity in this pathway. And what I'm suggesting that U.S.-China working together collaboratively in a friendly way creates that connector across the median strip to connect with the other road. And I envision that road is the multi-lane, multilateral superhighway with a supply chain that is brimming with public health goods that are going deep into impoverished nations. And China has the ability to join this convoy, dedicating its workforce, its finances, its expertise, and the heart of the Chinese people. I'm of Chinese heritage. I probably know this. And together, if we can build this convoy and look at the horizon of aspirations, our most noble, ambitious goals, and we can say that we can achieve a fulfillment of a campaign of liberation by defeating AIDS, defeating TB, defeating malaria. We free millions of people. We save 20,000 people a day from death, disease, and debilitation. And we achieve a very tangible outcome, which is parents alive for their children, children alive for their futures, and entire nations alive for their destiny. And that is why I feel so passionately about this. And thank you very much.
Well, we seem to have converged on a series of road and construction metaphors to articulate the differences as well as the areas of agreement among our between our two panelists. Andrew's basic position being, yes, China should be chipping in more money on global health. Jack saying, no, it ought to be shoveling in more money on global health. Andrew feeling that China is on the right road. It's just going to progress slowly toward the destination, but it is on the right road. And Jack feeling, no, it's on the wrong road at this point and needs to get on the right road. And then finally, we have our automotive analogy or transportation modality analogy, which says that, in effect, Jack believes China has to get on board now a major international global convoy to combat these diseases in very poor countries. And I guess that would leave you, Andrew, arguing that China needs to develop its own unique little car at the moment and chug along and get there, pursue this same path, pursue this same road, but get there perhaps at a slightly different timetable than Jack would like to see. So with that, we have our fault lines clearly established. It is unfortunate that we're using the phrase fault lines today on a day when there has been a terrible earthquake in other parts of the world. And so once again, we emphasize our solidarity with the Japanese people and with others who may be threatened by the aftershocks as well as the tsunami. But we thank all of you for coming today and look forward to engaging you in the next of the debates over the fault lines in global health. So thank you very much.
Thank you, Susan.
Great, thanks.
Thank you.
That was great.
Okay,
Really great.
yeah.
Thank you, Susan. Really very well done, both of you. Thank you.